Good morning. My name is Jody Lown, and I am on the executive board of the Autism Society. Every quarter, we have a family forum where we invite speakers that we hope will provide you with good information and excellent resources. So today we have a great lineup, and right now I'm going to introduce Renee Huff. She is going to be with us via Zoom, so we're trying it a little different. Renee Huff with State Office, and I'm going to let her tell you about Medicaid and ABA. Hey, Renee.
Hi, my name is Renee Huff. I've been with the ABA program with Medicaid since its inception, and I have a team under me that helps me manage the program. Let's see. All right, so we need to know what ABA is. So ABA is the therapy that helps people and families learn new skills, improve behavior. It's often used in children with autism and other related disorders. The therapist sets goals, breaks them into small steps, and each step is taught and practiced with clear instructions and rewards, such as praise or providing treats for good progress. This makes learning fun and encourages positive behavior. The therapist tracks how well the person is doing and adjusts the approach if needed. This is a step-by-step method using rewards, and it helps people develop important skills and positive behaviors and improves their lives. So who's eligible for Medicaid-covered ABA services? So Medicaid beneficiaries under the age of 21 can receive ABA services if they have behaviors that significantly interfere with home or community activities. They've got to be diagnosed with a condition such as autism for which ABA is appropriate. And they have to have an evaluation by a qualified healthcare professional to see if ABA is appropriate. For Louisiana Medicaid to pay for ABA services for your child, it has to be approved by your Healthy Louisiana plan before services are provided. So how do you get Medicaid covered ABA services? So ABA services are covered through your health plans. Right now we have Aetna, AmeriHealth Caritas, Healthy Blue, Humana Healthy Horizons, and Louisiana Healthcare Connections. These are called managed care organizations or MCOs. To get ABA for your child, we have 3 big steps. You have to have your child evaluated by a qualified healthcare professional, find an ABA center or therapist who will provide services to your child, and cooperate with the ABA center or therapist in the assessment process. There may be waiting lists for the evaluation with the qualified healthcare professional and the ABA center or therapist. You want to start looking for resources as soon as possible due to long wait lists. Have your child evaluated by a qualified healthcare professional. Your child must first be evaluated by this healthcare professional. We call it a comprehensive diagnostic evaluation. After the evaluation of your child, the healthcare professional will prepare a report explaining why your child does or doesn't need ABA, and any other therapies they may need. And then they need to provide the report. You need to provide the report to the ABA center or the center or therapist that provides ABA services. The ABA center will send that documentation on to the health plan. So it gets tricky finding someone to complete the evaluation, that qualified healthcare professional. So let me tell you who can do it. Your child's pediatrician can do the evaluation if he or she is willing. If not, then the following types of healthcare professionals are also qualified to do these evaluations. So a lot of times your pediatrician doesn't feel comfortable making this diagnosis, and they'll refer you to the pediatric neurologist, developmental pediatrician, psychologists. Sometimes we have pediatric teams with joint working agreements, and they might have OTs, PTs involved, audiologists involved in diagnosing developmental disabilities. A nurse practitioner under the supervision of a pediatric neurologist developmental pediatrician, psychologist, or psychologist can also do these evaluations for you. So to find a qualified healthcare professional, you need a licensed individual. You can also have a licensed individual that's they have a licensed clinical social worker, a licensed professional or counselor can do the evaluations when the individual has 2 years of experience providing diagnostic assessments for ASD and comorbid disorders and treatments, or is being supervised by a pediatric neurologist, developmental pediatrician, psychologist, or psychologist. The individual scope of practice has to include different levels of diagnosing ASD and comorbid disorders or similar disorders for the age and cognition level of the member. That's a lot. That section's a lot. And trying to find the clicker. I'm trying to get my mouse on the right screen. Sorry, guys. Nope, that didn't work. There. Okay. The healthcare professionals must have agreement with your child's MCO to be paid by Louisiana Medicaid. The MCO can make a special agreement if needed. If you need help finding a qualified professional to evaluate your child, you can ask the pediatrician for a referral or to contact your child support coordinator if they have one, or your MCO. All right. So the next step 2, is finding an ABA center or therapist who would provide the services. You select an ABA provider from your MCO's list of providers, and below you'll see the list of the websites where you can find those listings. If you need help finding an ABA center or a therapist to provide your ABA services, you can ask your child's pediatrician for a referral or contact your support coordinator if you have one, or their MCO. So we have multiple ways you can find that ABA provider. Cooperate with the ABA provider in the assessment process. The first evaluation, the CDE, was to see whether or not your child needs ABA service. The ABA center or therapist must assess what specific ABA services will help your child. Both will be submitted to your MCO and requesting approval for ABA. So the ABA provider really gets into the nitty-gritty of, do they need help with toileting? Do they need help with hand-eye coordination? Are we going to work on speech? Are we going to work on sitting in a chair? Those really small things that build up into big skills, they really break it down, and that's what they put in the plan to the MCO. Okay, we got some frequently asked questions. Well, what if the MCO denies all or part of your ABA request? Well, if the MCI denies the approval in whole or part, the MCO has to provide a clear reason and explain how to remedy the denial. So you need to know what's missing and what would make it approvable. The ABA provider may ask the MCO to reconsider their decision, or you may appeal. Also, you can request the service multiple times. There's no penalty for requesting the service more than once. That's with all Medicaid services. Okay, why does my cursor keep moving? Causing me trouble. Okay, what missed in the evaluation report? These are the things that need to be included. So this is the report done by the medical professional, not the ABA provider. So they want a full clinical history that can be informed by the parent or caregiver with a developmental and psychological history. We want to know that the provider diagnosing them directly observed the child. This includes, but it's not limited to, assessments of current functioning in areas of social and communicative behaviors, play or peer interactive behaviors, a review of available records, and we want a valid diagnostic code or diagnosis from the DSM-5. So, and it needs to be autism spectrum disorder, or any other condition for which ABA services are recognized as therapeutically important. So that's important. It's not limited to ABA, but that doesn't mean anything and everything qualifies you for ABA services. There has to be empirical evidence that ABA can be effective with the condition. So we also need a justification and rationale for referral or non-referral of the child for ABA services, and then recommendations for any other treatment. So they should say, we recommend a specific medication, speech, OT, maybe an ENT evaluation, maybe a GI evaluation, all those things that could be beneficial to a child with autism or related disorders and help address some of the things that we're seeing. Why does it keep doing this? Okay. How long are ABA services approved for? They're initially approved for no more than 180 days. The ABA provider must conduct additional assessments at least every 6 months, and approvals are renewed when medically necessary. So every 6 months they do a new assessment, and we want to see, did they meet the goals for the first 6 months? Were there barriers to those goals? If there were, how were the barriers addressed, and what are the goals for the next 6 months period? And then how much time do they need for that 6 month period? How much time per week of ABA does the child need? Okay, and can a member change providers? Yes, you can change providers every 180 days when the approval expires, unless there's good cause. If there's an allegation of abuse, no progress from the beneficiary, or this happened a lot when the program was first getting off the ground, a new provider opens in an area that hadn't been available before. You've been driving an hour one way every day to get your kid to ABA services, and now there's one in your hometown, 10 minutes from your house. We would allow that switch. When a dispute arises between the parent, caregiver, and a provider that can't be resolved. If a provider change is requested, you've got to have good cause. You need to do this before the authorization period ends. You need to contact the MCO if it's during the authorization period. And the case manager or support coordinator, the MCO needs to be contacted because we have to turn off one PA, and then you can send in the PA request. But they need to know what's happening, or it'll be seen as a duplicate PA and be automatically denied. What if your CDE is old? Because sometimes we get these diagnostic evaluations and we wait for services. So the MCOs cannot deny ABA services because the CDE is too old. If an MCO requests a new CDE, whether to start or continue services, they should not stop or delay approval of ABA services while waiting for a new CDE. The MCOs are responsible for arranging these CDEs they're requesting. So in other words, the ABA spots come open. The ABA provider sends in a request with your CDE that might be 3 or 4 years old because you've been waiting a long time. If the MCO wants you to get a new one, they need to approve ABA and help arrange that CDE request. They can't just deny it based on the age of the CDE. And then here we go, wait list. A lot of our providers have wait lists. The program's grown by leaps and bounds in the last 12 years. We have providers in most areas of the state, but we still haven't been able to meet the demand. Currently, Medicaid serves, last year we served about 6,000 kids through ABA. That's a lot. But many providers still have wait lists for new patients. And so for assistance with finding an ABA provider, contact your support coordinator if you have one, or your MCO. The MCO has people willing to help. This is how a lot of us feel. I feel like this in my office a lot of times, and I'm sure you parents feel like this a lot of times, that you're just banging your head up against a brick wall. we all get frustrated trying to work the system, whether you're on the inside or the outside. So if you have issues with the support coordinator or your MCO, you can't get help. If you have questions about ABA services, you can reach me or my staff with this phone number, 1-844-423-4762, or you can email appliedbehavioranalysis@la.gov, and somebody will respond to your email. Or if you ask us to call and leave your number in the email, we'll give you a call. We'll get in touch with you. And these are your MCO contacts. I'm not going to read them, but these are the MCO contacts. Reach out to those MCOs first. They're your first point of contact for your evaluations and getting ABA set up and organized. If you call us and you haven't gone to the MCO first, we're going to direct you back to the MCO. All right. Questions for me?
Yeah. If someone is interested in their child starting ABA, they already have their medical diagnosis. They still have to go to the pediatrician for a prescription for ABA.
No.
Is that correct?
So, no. If you have a psychosocial evaluation that has everything we need, my kids have ADHD and non-autistic motor stereotypes. My oldest one did. We got that full psychosocial educational evaluation, and at the last page or paragraph has all the recommendations. If ABA is listed in there, you do not need a separate prescription. If ABA is not listed, then you need another prescription. Does that make sense?
Yes.
At the beginning of the program, people weren't prescribing ABA because it wasn't available.
So, one of the issues that a lot of parents have is, let's say their child doesn't start the process to get an evaluation for autism until the child's maybe 7 or 8. The wait list to even get evaluated is upwards of 2 years. By the time they wait the 2 years and finally get the evaluation, then they have to get on a wait list for ABA, which can be another year and change.
Some providers won't put you on the wait list till you have the evaluation.
Correct. And so what's happening
is really
like the children are already, by the time they've reached the point that they get accepted into ABA, these ABA facilities are saying that they're too old or they don't meet the age requirement. Is there some way around it?
That's not a Medicaid requirement. That's how those individual providers are choosing to practice. It's just like you call a doctor and they're like, sorry, we're not taking new patients. So the thing to do at that point would be to call the MCO, let them know, and ask them if there are ABA providers taking the older kids. I would just encourage parents that if you suspect autism, don't wait. Sometimes don't wait for the pediatrician because sometimes they don't see it. Like with my oldest, he was 7 before we got a good diagnosis, and I kept saying, something's wrong, something's wrong, something's wrong. Does he have Tourette's? Because he was shaking and like he was stimming uncontrollably, but he could say big words and never met a stranger. And I kept saying something's wrong, but I didn't want to panic. He was 7 before we got him diagnosed. Luckily, medication and OT and Taekwondo did a lot of good for him. But the diagnosis part is really difficult. And while I don't have a kid with autism, I've been through the process and I get it. Like even with state group insurance, I had to wait several months for a diagnosis. So it's not a Medicaid specific problem. I think people with other insurance coverage have the same issue. It's just early diagnosis is the key. And on the kids that are like on the cusp and aren't really severe, it's even harder to get them that diagnosis early. That's my thought process on that.
So another challenge that our community members seem to face is finding evaluators. Where can we point people to find evaluators. Some people are traveling upwards of 5 hours out of state even to even get an evaluation that sometimes they've waited over a year for.
I know. So we have updated the ABA manual because of this. This has been a problem that we've struggled with since the inception of the program because, and I believe this going through with my personal experience, you need to know what's really going on to treat the child properly, right? So we need a good diagnosis, but we don't have enough providers to do it. The providers are in Shreveport, Lafayette, Baton Rouge, and New Orleans. And so you do some in Lake Charles, but you have people really driving for those clinicians, the developmental pediatricians and psychologists and neurologists, a few and far between. So we do allow the pediatrician to diagnose and do the CDE based on the MCHAT score of 8 or higher. Because those are usually your really clear cut cases of autism. And it's a balance because we want to make sure the kids who need ABA get it and that it's tailored to the kids who need it the most and not just every kid getting ABA when they might just need speech or OT. You know what I'm saying? It's an allocation of resources thing as much as it's not just money, but we only have so many providers to go around. So we want to make sure the kids that really need it get it. So the pediatricians can do it. If y'all have pediatricians that need to understand more about ABA, I'm happy to do a Zoom call with them. I have a presentation geared towards clinicians. I was doing a lot of that last year throughout the state, and then I got thrown into another project and I wasn't able to keep doing it. But if y'all know of anybody who wants to learn more about ABA and how to do the diagnostic portion, send them my way, give them my email, and we'll set something up.
Awesome. Last question. Could you make your slideshow available to share with our viewers?
Yes. I'll send it to Jody.
Yes, that would be great.
Thank you so much. This was very informative.
Thank y'all. Y'all have a great day, and we're here to help, so don't hesitate to reach out.
Thank you, Renee.
Thank y'all.